Hello, welcome to the Empowering Minds podcast. Today, we're going to be discussing Red Noses International, the art of clowning, and connection. So, if you'd like to introduce yourself.
So my name is Natalie. I'm the CEO of Red Noses International. I started working for Red Noses more than 20 years ago. I started as an intern and worked my way up to the CEO position. And our organization is focused on the intersection of arts and health, arts and mental health in particular. So we work with trained professional artists in the field of clowning, and we send them to places where laughter and hope is lost. I think what is very beautiful about our organization and makes it quite unique is that we go to the places where maybe art is most unexpected, and especially art of clowning, where you would just literally not think about that a clown should go and a clown is needed there. But this is exactly what we're looking for. So as I mentioned already in our pre-chat, that I'm just coming back from leading one of our humanitarian response missions to Egypt, where we work with a displaced community. In this case, it was people from Sudan, affected by the Sudan conflict, and of course by the conflict in Gaza. And sometimes we just got out of the car before we started our activities, thinking, even after 20 years, thinking, what am I doing here? Is this really where we should be? And then it always turned out to be the best activity. It always turned out to be um, the moment where really the art of clowning could bring back the hope or could just give people these moments of reconnection, these moments of connection to their own inner emotional worlds, to their own inner beauty, to their own humanity. So I think this is what art can really bring, and this is why I love, love, love working for Red Noses. Is that this world of contradiction? That more than one thing can be true. You can be sad and happy. It can be light and dark, and it also creates there's like these opposites just create themselves automatically. So they're up creates down and light creates dark, and that somehow we move between these polarities of the world, and we don't negate the darkness. It's not about naive optimism creating, pretending that the suffering and the darkness doesn't exist. It's just not focusing on the or, but the end. There can be darkness and light, and somehow our art form, our form of working with art and mental health is really highlighting this, like this contradiction of the world. And we like to put it in a binary, but it doesn't work like this. It's everything exists at the same time, and it's beautiful. And yeah, we choose to go to the places of suffering and hardship, and we're not saying that it's that you don't suffer, that we can heal. We're not saying this, but we show you that there is something else out there, and that despite the suffering, you can still feel joy, even if it's only for a few moments.
I suppose the next question really is sort of obviously you're going into these darker places, but it'd be very interesting to hear what it is that you do there exactly. So what your core programs are. I seem to remember there were four. Do you want to tell us about those
Yes,
four core programs?
absolutely. So we come from the healthcare sector. So it is we have a four program is our big four programs are healthcare environment, healthcare sector, people with disabilities, humanitarian response, and older citizens. However, the people with disabilities, we now learn that it's not so much its own program, but it's more something that we want to establish all around our activities, where I say we want to be more inclusive in all our approaches. So it's a bit of it's still our fourth program, but it's step by step becomes kind of like merged into all of our activities, the wish to be inclusive. So our core program was and will remain the healthcare environment. So there we started very humbly because there was not our founders who founded this organization more than 30 years ago. Of course, it was a crazy idea. Like what clowns in a hospital environment, that is just unheard of. But they were relentless. They stuck with it. They believed in this idea. And 30 years later, most of the big European hospitals are in Central and Eastern Europe. It's almost normal that we are there. So we are really trying to also there now shift our focus to where we need it the most. because also the healthcare environment is changing a lot. You know, you try to keep the patients in the hospital as short as possible. Has pluses and minuses, this approach, in my opinion. Um, but there are a lot of moments of really high stress and where mental health is at risk in the day-to-day life of the hospital environment. And so we're also trying to shift to be more there, to really work as partners with the healthcare staff, to really try to accompany the children right into the surgery room, right before they get the anesthesia, right when these moments of loss and the loss of control and the loss of empowerment are very, very strong. So children, I mentioned it, children is still the main target audience. However, we also see, so it's a primary target audience. However, we also see how much the whole environment that we work in is affected positively by the art of clowning. So we also see that the medical staff, some of the procedures it gets easier for them to conduct these procedures, or that parents have also this moment of relief when they see their child actually relax and laugh. Um, then, of course, our older citizen program. This is also been in place for about 15 years, but we're refining it more and more. We really want to focus on where older citizens are in risk of isolation, and especially diseases that are more stigmatized, like dementia, Alzheimer, like these kind of diseases, where also taking care of patients with these diseases is a lot of stress and a lot of burden. So actually, the European Union funded one of a big flagship program, which we called Clown Nexus, Clowning Connects Us, where we learned a lot about this specific target audience. And we just got the news last week that we received the second funding cycle of the Creative Europe section of the European Union. So we're very, very excited about that. So we want to learn more about that also in the next years. But it's there with all the citizens. The approach is a little bit differently. It's a little bit to really recreate the memories from the past. So we use a lot of music from their childhood. It's maybe it's a more gentle approach. It's a lot about relationships, and also again meeting people where they are, because that is the beauty about clowning. Like, we don't come in with expectations, but we're just there, and we just accept the whole situation as it is. So this is also very, very nice. And in some of the regions that we work in, isolation is a big topic, especially for the elderly population. So we also try to bridge that. And then the humanitarian response is our youngest but fastest growing program. It's about 10 years old now, roughly. And it started all with also the idea of bringing clowning into disaster areas, or like what we call people affected by natural or man-made disasters. And right now we work a lot with displaced communities in the European region, but also in the Mediterranean region. And this has a lot of potential. It's like I mentioned, it's our fastest growing program because the demand is there. We just need to get the funding and the structures in place. I don't know if this is good or bad, because it just points also that there are a lot of crises out in the world and a lot of stuff is happening. And also through this big, worldwide crisis like climate change, that also the crisis gets closer to home. So last year, Austria was flooded, Poland was flooded. So we're really also working there. And this is the one program that is directly handled by Red Noses International here in the headquarters. And yeah, and you also asked about like how do we do it? What do we do? So what's our method? I guess that's the question. And please feel free to just jump in with questions. Okay, great. And yeah, so our method is the art of clowning. So we work with professional artists, and with professional, I mean professional artists. So we're not volunteers, so our artists are paid, and we train them for what they do. So every artist that works in Red Noses has to already bring some form of artistic know-how, performing arts, music to the table, and then we run through we hold auditions. Hopefully they're taken or not, but they're ones that are taken, then kind of proceed to our internal training curriculum, which comprises more than 400 hours of training for the artists in the not just in the artistic field of clowning, so improvisation, music, partner work, but also working with our target audiences. So, and then we have an internal certification. After 400 hours, you are a certified red noses clown. Obviously, you continue your training, but then it's kind of like a highlight for our artists to receive the certification, and then you do what you do. And like I said, mostly it's the healthcare environment, but then we also have this humanitarian response program, which requires special training. So there we take artists that have already been working with us for a while, because not you you don't only have to be artistically really, really well refined, but you also need to bring a high level of social competence to the table. You know, go to a crisis area, you live there with a team for minimum 2, maximum 4 weeks. You see very strong images that you need to be able to process. And so yeah, this is what we do. And it sounds so simple, like so many things in life, and yet there's so much behind it. And clowning, or the art of, or like the philosophy of clowning, I think there is so much truth and so much wisdom in there that I wish every human being understands the beauty of the art of clowning, and understands like what we can actually learn from a good clown. And I'm not speaking a birthday clown making balloon animals. I'm not speaking about this. I'm speaking about highly professional artists that are deeply rooted in a belief of giving back, deeply rooted in a belief of creating human connections, of bringing light where it's dark, and of embracing their own failures and their own quirks and the funny side of life that is always there. Funnily enough, it's always there, even in like the most absurd moments, or like moments where you think humor here, it's always there, and it makes us very, very resilient.
I think in the presentation that I'd attended earlier, there was this whole thing that I thought was great, which was that clowning is obviously about bringing the light forward and into these dark places, but also about ensuring safety, consent, and respect in the clowning. And I thought that was fantastic. I suppose the next sort of natural question is, what's next for Red Noses International? I think we've heard obviously that the one of the core pillars is growing rapidly, which the reason for it growing rapidly is a shame, but it's good to see that there is a response to the growing need. Is there anything else that's coming up that you think people would be interested in hearing about? Anything major, events, campaigns, etc.?
Mm-hmm. So it's a good question to ask this right now, because we're just finishing one strategic cycle and we're starting a new one beginning next year, where we've been working for more than a year, almost a year and a half. We've been working in the collective leadership of Red Noses, but with actually everybody involved on a new strategy. A 5-year strategy in the world that we live in is a bold move, because like things can change rapidly. And somehow it always boils down then, if I'm facing as a CEO an impossible question or an impossible choice, I always think, what would a clown do? Or what can we learn from the wisdom of clowning? And somehow I always find the answers there. But you asked about what is next. So I think what I really want to envision for Red Noses is to do more of what we already do. So it's not like we totally need to reinvent everything, but I really want to shift our focus and our resources even more to places where we are really needed. So really like not nice to have, but must have. And this needs certain pathways. So not just do we need the best artists, but we also need amazing partners. So we really need partners, and I'm choosing the word partner. So we want to work in places where we can actually co-create together with our institutional partners. So let's say a hospital or a partner from the humanitarian aid field, where we can really together create something amazing for the target audiences. So it's not, we're not knocking at the doors anymore and be like, hey, please, can we come and can we show you what we can do? But no, we are here. These are the requirements that we need to work with. This is what we can bring. This is what you need from us. So, and this shift also in the healthcare environment will, for instance, manifest to really have more visits in these super stressful moments in a healthcare routine. So procedures. We also work, for instance, in some coma wards, which the mental health burden there is immense on everybody, not just the patients, but also really the whole environment. We work more in settings of gender-based violence, so it's like these, like to really go where the darkness is, a little bit where the suffering. So this is what definitely is next, and I'm confident that we are ready for this. And that partnership, this elevated partnerships, how we call it in our strategies, I think should lead then more to also to be a bit more active on the advocacy part of our work. So advocating for mental health, advocating for more empathy, advocating for arts and mental health. So that is really something that is also now, it started organically, but that we really want to do more intentional. So today is already a good example of it. So to really also make our message heard and to create the strategic alliances, the strategic partnerships, because it's not just about clowning, it's also about arts and mental health in such, and there are amazing initiatives out there. And I really am confident that if we take mental health seriously, we can create more resilient societies. That lead to more empathy, that lead to more conflict resolution, that leads to more solution finding, that lead to more democracy, that lead to so I'm a firm believer that mental health is somehow the key to a lot of our issues that we have out there. And I'm happy that with Red Noses we can highlight maybe a little bit of a out of the box kind of approach, because mental health fundamentally is human and we all need it. It's like something that should be a right to every single human being out there. And so that's also what's next. We also want to increase our research activities because sometimes you just need facts and figures to prove that what you do is going very well. So we also have some really good initiatives already out there. We work together with the WHO in a 3-year research project in Lesbos, so working with the displaced community there. So these are the big pillars on the outside. So focus the shift to where it hurts the most, elevate our partnerships, and amplify the knowledge and the advocate for mental health in general out there. Internally, we also need to get, of course, funding is always an issue. We always need to be very clever where to get the money from next. So I also believe in the as within, so without approach. So we need to be strong on the inside so that we can manifest the things that we want to see, the impact that we want to see on the outside. So there are some organizational, structural things that we need to pay attention to, have very strong leadership in place throughout our Red Noses group, shared responsibilities, co-leadership, all of these mechanisms. And obviously the brand needs to also flourish. So that's our strategy in a nutshell. And I think, the vision would really be a more humane, more connected society, that where people can understand that laughter and joy is not something that you need to just fight for. It's a right. And even in the most dire circumstances, you have a right to joy. You have a right to be, it's one of our basic emotions, one of our 6 basic emotions. You just need to be reconnected to it from time to time. And then it gives you the hope and the strength to continue, because we all face issues right now. I mean, being a human being in the world today is not easy. And to somehow create happy memories and shift the focus to something that is still going well is extremely valuable, in my opinion.
I think that's fantastic. And I mean, so normally what we do is as we close this, are there any final thoughts or comments that you feel haven't come up yet, or yeah,
Mm.
and then we usually try to end on a positive or empowering note, but I think you've already achieved that quite well, so
Well,
I
that's
don't know if
mental,
that's
right? I mean,
necessary.
should be empowering. Mental health is empowering,
Absolutely.
and mental health is so valuable. I think one of my messages would be really to encourage everyone, every single one, is that it's possible to experience joy. I've seen it. I've seen it. I know I'm speaking from a very privileged position. I'm sitting in the most livable city in the world. I'm just, being cold right now, but that's about the biggest problem that I have right now. So I know I'm from speaking from a privileged position, but I've seen the people that we meet, the audiences we meet just last week in Cairo, who have been through in unimaginable hardships, unimaginable. I'm not even going to repeat some of the stories I heard here. Um, and they're not victims. They're powerful people that we encounter. So if they can laugh, if they can experience moments of joy, we can all do it. And I think we just need to be reminded of it. We need to be able to look for it. So that's would be one of my messages is there's so much you can do yourself to also increase your own mental health. Ask for help if you can't do it. That is also very, very important. And look for art. And art can be something that is very different for anybody. It can be you can produce a piece of art yourself, and it gives you some moment of peace and focus. You can join a choir. You can go to a museum. So there are these moments around us that can give us a lot of power, that can give us a lot of empowerment, and take care of your mental health. It's one of the biggest, most valuable goods that you own. And if all is lost, call Red Noses. embrace clowning and learn more about clowning and learn more about their amazing philosophy of acceptance. It's almost Zen Buddhism that a real clown represents of not and acceptance. It has like clowning has a lot to do with acceptance. So accept where you are, but know that you can do a lot of things also for yourself.
We hope you enjoyed this episode of the Empowering Minds podcast. Red Noses International relies on donations to operate. If you'd like to find out more about their work or donate, you can find them on their website at rednoses.org or follow them on Facebook and LinkedIn. If you're interested in finding out more about the work that Mental Health Europe does, you can find us at mentalhealtheurope.org or follow us on Facebook, Instagram, LinkedIn, and Blue Sky.